Absolutely. And another large part of my research and something that I like to bring up because I think it's really important is what sort of we refer to as alcohol inequities. And what mean here is that, in particular, people who have minoritized racial ethnic identities, minoritized sexual gender identities, the number of problems that accrue at the same level of alcohol consumption look really different, right? So a lot of this, like, I can have 3 drinks a day, I'm fine. There are many people. I have a former mentor who'd always talk about sort of the older, wealthy white man who's had a bottle of wine a day for his whole life and has really never experienced major consequences from that alcohol consumption, right? If he goes out to a bar and gets too drunk, he can call a taxi. If he needs to take a day off of work, he can, right? So there may be these chronic health conditions, but really he can continue to live his life because he's buffered from some of these like acute consequences. When you have additional stressors in your life, the whole range, right? When you have some of these minoritized identities, your stress response, all of this looks very different. So the risks that accrue around 1 to 2 drinks a day that you sometimes don't see in other groups. And here I'm not talking about cancer, right? The physiologic response will be the
Yeah.
same, but there are it doesn't impact everyone the same way at the same level of quote unquote moderate consumption. And I think it's important to point that out to people who maybe don't have any of these minoritized identities and are unaware of this, right? So just again, like thinking about it from a population level, sort of all of us together, whom is it impacting? Who is shouldering the burden of consequences? And is it really fair for the rest of us to not understand that, right? I think I always like to point that out.
Yeah, absolutely. And when you talk about sort of the impact, it's not that it's not clearly, disrupting sleep, causing issues with their body, causing issues with their brain, with their memory, it's like they can financially afford it. They can get through it. They can get help. I actually just yesterday talked with someone who runs an inpatient treatment center. They contacted me. They're sort of interested in post care and resources for people in different areas. And I am a huge fan of inpatient if coaching, group support, meetings, whatever it is not enough for you. And for very, very many people, they do need to be removed from their current situation, removed from alcohol, have time to heal, et cetera, et cetera. But when you're talking about resources, this facility is top of the line. It is gorgeous. It is a former hotel resort. You can have time to do meetings. Lots of CEOs go here and other people, right? I asked how much it cost. $75,000 for 30 days. I mean, my God, I almost choked and I was like, I get it. That's incredible. I am glad that anyone who struggles with alcohol can get the care they need. But oh my God, you know what I mean?
Mm-hmm. Absolutely, yes. And I think, yeah, when you think about cost effectiveness as well, I always like to sort of put in a plug for prevention and primary prevention. And so this is once again where the public health perspective comes into things. So, we have known for 40, 50 years, there are structural policy, community, state level things we can do to reduce the risk of developing an alcohol use disorder or this impact and getting to this place with this really expensive treatment where not everyone can access it and it exacerbates inequities, right? These are simple things like taxes, right? Increasing taxes on alcohol, decreasing the hours that bars are open, decreasing the number of bars and off-premise outlets that sell alcohol. They're pretty straightforward things. And you see, once again, shifting that curve, they make a really big difference. We saw this when the legal drinking age went from 21 down to 18 and then to 21 again. It had a big impact.
Yeah.
In the UK, their bars used to close much earlier. A lot of them had rules about midnight or 1 a.m. and they extended it to 2 a.m., 3 a.m. and all sorts of problems started popping up at the end of the night, right? Like violence related problems. So, um, people may not like these because they like
To
their
drink.
alcohol to be convenient, right? The
Yeah.
majority of us drink. And so the majority of us want to have cheap, easily accessible alcohol. But these are all choices that we make that have a big impact.
Yeah. I've talked to doctors on this podcast before, and one of the things that I think definitely could help, I mean, everything you mentioned, absolutely. But also, when you go into your primary care doctor, they do early screening for diabetes.
Mhm.
They do early screening for high blood pressure. Um, they literally are not taught to do any screening for alcohol use disorder in the mild, moderate, or severe stages. I've talked to them that said on their rotations, you have to specifically opt in to learn about addiction medicine. There
Mhm.
was otherwise a total of 2 hours in medical treatment that touched on this. And that's incredible to me when you talk about it being one of the five most preventable causes of death,
Mhm.
essentially.
Absolutely, yeah. And even when they do say, "Oh, there's screening," sort of in parallel with this, I don't know if this has ever happened to you, but it sort of became the norm in the last maybe 10 to 20 years that particularly when you would go to see your OB-GYN, they're supposed to ask about, partner violence. And I can't tell you how many times they've said to me, oh, well, like I don't need to ask you this question, right? Like you and your husband are fine, right? So even when they have screening questions, so they would take a look at me as like a nice white lady. And so even if they were supposed to ask about alcohol, my guess is most of them would say, I don't need to ask that question, right? Like she seems
Yeah.
fine. So people
And
make assumptions and they don't even do the basic screening when they're supposed to.
yeah, definitely. And also, I mean, yes, I went to doctors for years and completely downplayed how much I drank. Absolutely. But there are ways to ask questions to uncover, especially in the early phases. Like, do you ever not remember stuff after you drink? Do you ever wake up in the middle of the night? Do you have increased anxiety? One of the first steps you can take is to remove alcohol and see what that does for your anxiety and sleep. We are much more likely to be prescribed Ambien when you say you wake up in the middle of the night, and I'm talking from personal experience, than to ask, okay, does that happen more when you're drinking? Before I prescribe you Ambien, I'd like you to stop drinking for a period of time, because then I was drinking a bottle of wine a night and taking Ambien because that was, my solution to the problem. Could be deadly to do that.
Yeah, absolutely. And we have so many really short, basic screeners for alcohol use disorder. That includes, right, like the audit, it has mild, moderate, severe. So it classifies those in those different ways. And almost everyone scores mild, right? Anyone who consumes any alcohol, to see just like the beginning of social consequences, for example, right? Or the basic physiologic consequences like, oh, I had a hangover last month, right? I mean, you start to see it at pretty low levels of alcohol consumption. And in the research and in some, clinical settings, these screeners have been used for decades and are very well established and really do a great job picking up on alcohol use disorder. So yes, they
Yeah.
should be in primary care settings. I mean, I know that our primary care physicians are already greatly overburdened, but
Yes.
this seems to be a place that would really, that basic screening. It's like a basic health screening seems if that were more widely implemented, I think that'd be very beneficial.
Yeah.